Pneumonia and tuberculosis, TB, are both serious respiratory diseases that can have significant health impacts, but they differ in their causes and progression. Pneumonia is characterized by symptoms such as chest pain, fever, and difficulty breathing, which typically manifest after a sudden onset, while TB symptoms, including a chronic cough, weight loss, and night sweats, develop more gradually over weeks to months. Treatment for pneumonia often involves antibiotics and supportive care, as it is usually caused by bacteria. On the other hand, TB requires a longer course of specialized antibiotics due to its highly infectious and resistant bacterial nature. Individuals with compromised immune systems, such as those with HIV or the elderly, are at greater risk for both diseases. But TB also has a unique risk factor in that it's more common in areas with overcrowded living conditions. Here's a more detailed look at the intricate aspects of pneumonia versus tuberculosis. Location of infection, alveoli versus bronchial tubes. Pneumonia primarily affects the alveoli, the tiny air sacs deep in the lungs where oxygen and carbon dioxide exchange occurs. It leads to an inflammatory response that fills these sacs with fluid or pus, impairing gas exchange and often causing symptoms like coughing, fever, and difficulty breathing. On the other hand, tuberculosis, TB, usually targets the bronchial tubes and surrounding lung tissue, causing a more prolonged and insidious onset of symptoms. TB can form granulomas, nodules in the tissues, leading to a persistent cough, sometimes with blood, weight loss, night sweats, and fatigue. Both diseases can be life-threatening but have distinct treatment approaches, with antibiotics being used for pneumonia and a longer, more complex regimen for TB. Nature of disease, potentially life-threatening versus generally self-limiting. Pneumonia and tuberculosis, TB, both affect the lungs but differ markedly in their nature and management. Pneumonia can be caused by various pathogens, including bacteria, viruses, and fungi, and often presents acutely with symptoms such as cough, fever, and difficulty breathing. Many forms of pneumonia are self-limiting, with the potential for full recovery with appropriate antibiotics or supportive care. However, severe cases can be life-threatening, especially in vulnerable populations such as the elderly or immunocompromised. On the other hand, TB is a chronic bacterial infection caused by Mycobacterium tuberculosis. It progresses more insidiously and can be fatal if left untreated. TB requires a lengthy treatment with a combination of antibiotics over several months. Failure to complete the treatment can lead to drug-resistant strains. TB also possesses a public health dimension, as it is highly contagious through airborne transmission, necessitating not only individual treatment, but also public health interventions to prevent spread. Thus, distinguishing between these two diseases is critical for the implementation of appropriate treatment and containment strategies. Duration of symptoms: weeks to months versus days to weeks. In distinguishing between pneumonia and tuberculosis, TB, the time frame over which symptoms develop is a crucial clinical clue. Pneumonia typically presents acutely, with patients experiencing symptoms like cough, fever, and difficulty breathing over days to weeks. On the other hand, TB, a chronic mycobacterial infection, often unfolds more insidiously. Patients may report a prolonged history of nonspecific symptoms, including persistent cough, weight loss, night sweats, and general fatigue, typically spanning over weeks to months. Recognizing this temporal pattern assists clinicians in prioritizing diagnostic investigations, such as sputum cultures or imaging, and tailoring immediate treatment strategies accordingly. Extent of infection, localized in lungs versus affecting airways. Pneumonia primarily affects the alveoli in the lungs, often causing a localized infection. It leads to inflammation and fluid or pus filling the air sacs, which can manifest as lobar pneumonia affecting one or more lobes, or bronchopneumonia with patchier distribution. In contrast, tuberculosis, TB, affects the lungs but can also spread to other areas through the lymphatic system or bloodstream, causing a much more widespread affliction. TB typically presents with caseating granulomas, indicative of a chronic immune response. The distinction is crucial as pneumonia usually strikes acutely and can be bacterial, viral, or fungal, whereas TB, caused by Mycobacterium tuberculosis, is insidious, persisting long-term and requiring a different treatment regime. Typical causative agents. bacterial, viral, or fungal versus viral or bacterial. Pneumonia is a respiratory condition that can be caused by various agents, including bacteria, viruses, and fungi. Bacterial pneumonia, often caused by Streptococcus pneumonia, can lead to a rapid onset of symptoms and is typically treated with antibiotics. Viral pneumonia might be linked to pathogens like influenza or respiratory syncytial virus, often exhibiting a more gradual symptom onset and generally resolving on its own with supportive care. Fungal pneumonia, less common, generally affects individuals with compromised immune systems. Tuberculosis, TB, primarily caused by the bacterium Mycobacterium tuberculosis, unfolds differently, typically presenting with a chronic cough, weight loss, night sweats, and can remain latent and asymptomatic for years. Treatment for TB is prolonged, requiring a combination of antibiotics over several months. The differential diagnosis between pneumonia and TB hinges on clinical presentation, chest x-rays, sputum analysis, and specialized tests like the tuberculin skin test or interferon gamma release assays for TB. Both diseases can be severe and potentially life-threatening, demanding accurate diagnosis and timely treatment.